Do you know that prostate cancer is the second most common cancer among men worldwide? This is a startling fact that should capture our attention. Every year, millions of men are diagnosed with this disease, spanning every corner of the globe. It's a health concern that is both prevalent and often misunderstood. Today, we're going to delve into the basics of managing prostate cancer. We'll explore what it is, how it's diagnosed, the various treatment options available, and what life can look like for those living with this disease. The aim is not to alarm, but to inform and empower. Knowledge is our best tool when it comes to tackling health issues, and prostate cancer is no exception. Understanding the basics of prostate cancer management is key. It's a topic that's important not just for those directly affected, but for everyone. After all, health is a universal concern. So, are you ready? Let's dive into the basics of managing this prevalent disease. Before we delve into management, it's important to understand what prostate cancer is. Prostate cancer is a type of cancer that occurs in the prostate, a small walnut-shaped gland in men that produces the seminal fluid that nourishes and transports sperm. It's one of the most common types of cancer in men. Although it can be a serious disease, most men diagnosed with prostate cancer do not die from it. The development of prostate cancer is typically slow and initially confined to the prostate gland, where it may not cause severe harm. However, while some types of prostate cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread quickly. Prostate cancer occurs when some cells in your prostate become abnormal. Mutations in the abnormal cell's DNA cause the cells to grow and divide more rapidly than normal cells do. The abnormal cells continue living when other cells would die. The accumulating abnormal cells form a tumor that can grow to invade nearby tissue. Some abnormal cells can break off and spread, metastasize, to other parts of the body. Common symptoms of prostate cancer include trouble urinating, decreased force in the stream of urine, blood in the urine, blood in the semen, general pain in the lower back, hips or thighs, discomfort in the pelvic area, bone pain, and erectile dysfunction. However, please note that having one or more of these symptoms doesn't necessarily mean you have prostate cancer. Various other health conditions can cause similar symptoms, and it's always best to consult a healthcare professional if you're experiencing health issues. In many cases, prostate cancer symptoms are not apparent in the early stages of the disease. Symptoms of prostate cancer are often first detected during a routine checkup. Sometimes, however, prostate cancer does cause symptoms, often similar to those of diseases such as benign prostatic hyperplasia. Now that we have a basic understanding of what prostate cancer is, it's easier to comprehend its management. Early detection of prostate cancer greatly improves the chances of successful treatment. Prostate cancer, like many other health conditions, can be a silent threat. Often, it's not until routine checkups that the presence of this disease is discovered. One of the most common initial tests is the prostate-specific antigen, or PSA blood test. This test measures the level of PSA in the blood, an increase of which may indicate the presence of prostate cancer. However, a high PSA level doesn't always mean cancer is present. Other conditions such as an enlarged or inflamed prostate can also cause an increase. This is where the digital rectal exam, or DRE, comes into play. In a DRE, your doctor physically examines your prostate gland for any abnormalities. It's a quick procedure, but it can provide valuable information about your prostate health. If either of these tests suggests the possibility of cancer, a biopsy is typically the next step. A biopsy involves taking a small tissue sample from the prostate to be examined under a microscope. This is the only definitive way to diagnose prostate cancer. But remember, these tests are not perfect, and results can sometimes be misleading. It's important to have open discussions with your healthcare provider, understand the risks and benefits, and make informed decisions about testing. After diagnosis, the next crucial step is to determine the suitable treatment. But that's a topic for our next scene. Stay tuned. There are several treatment options for prostate cancer, each with its own advantages and disadvantages. Let's start with surgery. This is one of the most common treatments for prostate cancer. There are different types of surgeries available depending on the stage and location of the cancer. The most radical option is a prostatectomy, where the entire prostate gland is removed. This can be effective, but it does come with risks. including potential damage to nerves that control bladder and sexual function. Next up is radiation therapy. This involves using high-energy rays or particles to kill cancer cells. There are two main types: external beam radiation, which comes from a machine outside the body, and brachytherapy, where radioactive seeds are placed inside the prostate. Side effects can include fatigue, urinary problems, and sexual dysfunction. But for some men, radiation therapy offers a less invasive option than surgery. Then we have hormone therapy. The growth of prostate cancer cells is often driven by male hormones called androgens. Hormone therapy, also known as androgen deprivation therapy, works to reduce the body's androgen levels or stop them from affecting prostate cells. This can help slow the growth of cancer or even shrink it. However, it's not a cure, and it can cause side effects like hot flashes, loss of sexual desire, and bone thinning. Chemotherapy is another option, usually reserved for cases where the cancer has spread beyond the prostate. Chemotherapy drugs work to kill fast-growing cells, including cancer cells. While it can be effective, it can also cause side effects like nausea, hair loss, and fatigue. Lastly, there's immunotherapy. This is a relatively new approach that uses the body's immune system to fight cancer. For prostate cancer, one form of immunotherapy involves removing some of the patient's immune cells, altering them in a lab to better attack cancer cells, and then reinfusing them into the patient. It's an exciting area of research, but it's not right for everyone, and can cause side effects like fever and chills. It's important to note that these treatments are not mutually exclusive. Often, a combination of treatments is used. For example, a man might have surgery followed by radiation or hormone therapy in conjunction with chemotherapy. Choosing the right treatment is a critical decision that should be made after a thorough discussion with healthcare professionals. Each man's cancer is unique, as is his overall health, lifestyle, and personal preferences. All these factors should be considered when deciding on the best course of treatment. Remember, there's no one-size-fits-all answer. It's about finding the best option for you, given your individual circumstances. Living with prostate cancer is not just about managing the physical aspects, but also the emotional and psychological impacts. This journey can be challenging, but with the right approach, it is possible to maintain a fulfilling life. Mental health is a crucial aspect of this journey. Feelings of fear, anxiety, or depression are common, and it's important to acknowledge them. Seeking professional help, such as a psychologist or a counselor, can provide strategies to manage these emotions effectively. Regular follow-ups with your healthcare team are also vital. These visits are an opportunity to discuss any concerns, monitor your progress, and adjust your treatment plan if necessary. Maintaining a healthy lifestyle and diet cannot be overstated. Regular exercise, a balanced diet rich in fruits, vegetables, and lean proteins, and avoiding harmful habits like smoking can significantly impact your overall well-being and potentially slow down disease progression. Finally, don't underestimate the power of community. Joining support groups, either in person or online, can be a source of comfort and strength. Sharing experiences, fears, and victories with those who understand your journey can be incredibly therapeutic. The path of living with prostate cancer may be steep, but remember, it's a journey, not a sprint. Be patient with yourself, take one day at a time, and always remember to celebrate small victories. Remember, you are not alone in this journey. Reach out to others for support and keep a positive mindset. Let's quickly recap what we've learned about managing prostate cancer. We kicked off our conversation by understanding what prostate cancer is, a disease that primarily affects men, specifically in the prostate gland. We then delved into the methods of diagnosis. From physical exams to biopsies, there's a range of ways to confirm its presence. Next, we explored the various treatment options available. Whether it's surgery, radiation therapy, or hormone therapy, the choice depends on numerous factors, including the stage of the disease and the patient's overall health. Lastly, we touched upon living with prostate cancer. It's not just about managing the physical aspects of the disease, but also addressing the emotional and mental well-being of the patient. Remember, knowledge is power. The more you know about prostate cancer, the better prepared you are to manage it. Don't forget to subscribe to our channel for more informative videos like this one.